Greetings. My name is Dr. Waddell Brooks, Sr., your host, and this is Community Forum. Ladies and gentlemen, we're going to be talking about an outlook of the Lake County Health Department. And who's a better person to have than the Executive Director of the Lake County Health Department. We have with us Tony Beltran. As I mentioned, he's Executive Director of the Lake County Health Department Community Health Center, where they're concerned about healthy people, healthy choices, and healthy Lake County. Our co-host is Mrs. Nina Stokes. Good evening, Mrs. Stokes.
Good evening, Dr. Brooks.
We're very happy that you're taking time for your busy schedule to be with us also. We want to, first of all, start the program off by asking Mr. Beltran to tell our listening audience, and our listening audience, Tony, is approximately 100,000 Comcast viewers, but the program also airs in Time Warner, Kenosha, Wisconsin, and also CAN TV, Chicago, Illinois. So I want you to tell our listening audience a little bit about your personal and professional background.
Sure. First, thank you for having me on the program. It's great to be here and to really talk a little bit about the health department. But I'll tell you a little bit about myself.
Okay.
So I grew up in California. I lived there for many years. I actually moved to Illinois because my mother was in the military. So she was in the Army, and it was nice to have a chance to be able to come here. And so I'm not a stranger to Lake County. I actually went to Highland Park High School, graduated from Highland Park. And after that, went to college at the University of Illinois at Chicago. I'm also not new to healthcare. I've been in healthcare for over 20 plus years. So it's, I think once you hit that 20 plus mark, you don't have to say the exact number. But for me, I've been in for quite a while. When I started my career, it was at the University of Illinois at Chicago. I was the administrator for the Department of Family Medicine and worked there for many years, and luckily got to learn quite a bit at that department. But I really wanted to get to a place where I was serving individuals that were uninsured or underinsured. And so working with federally qualified health centers was really a calling for me to be able to do that type of work. So I worked with federally qualified health centers. I worked for a small federally qualified health center that was 2 community health centers when I was the chief operating officer, and we grew to 7 health centers. But I've also had the chance to work for the largest FQHC Access Community Health Network as a director for their programs, and had 21 of the health centers when I was there. So I've had a kind of a broad range. Right before coming to Lake County, I was the first deputy commissioner for the Chicago Department of Public Health, and really got a chance to learn a lot more about the integrated public health programs and how they work together to improve the health and wellness of the residents that they serve.
Well, Nana, we're very fortunate. We didn't have to look all over the country to find someone to direct the Lake County Health Department.
Wow.
We have one already been around the country, and he's back home now. So we're very fortunate to have you here. Tell us about the services that the Lake County Health Department provides.
Sure. So we're one of the departments within the Lake County government, and are lucky to serve quite a few individuals through the programs. We have about 45 different programs that we have at the health department, and they range in programs, and about 1,000 staff members that we work with that are in the health department. So it's a pretty broad-ranging program. Some of the types of services you'll know. So there are things like restaurant inspections. We do over 3,000 restaurant inspections. Inspect over 3,000 restaurants every year, so that's quite an effort to do that. We also do programs like lake water management and landfill programs, but we also do communicable disease, so we try to make sure that the health and welfare of individuals is well in control. We provide a lot of direct services, so we have family case management services where we have nurses that go out into the community for expectant mothers and really teach them a lot about parenting, and then help them when their child is born for that first year along. We have nutrition program for women, infant, and children, so we provide lots of services there as well. But we provide a broad range of clinical services. We operate a federally qualified health center. We have 8 locations in our federally qualified health center. 6 of them are open to the whole community. So anybody in the community could come and be seen in our health center. And we have 2 locations that are specific for populations. So one of our locations really helps individuals with severe mental illness to try to address their health concerns. And then another one is the school-based health center. We were excited to open a school-based health center last year. We also provide behavioral health services in the health department. So we see about 8,000 individuals that have either a mental health issue or a substance abuse issue or co-occurring disorders. And so we provide comprehensive services for them, whether it's outpatient psychiatry or therapy or inpatient detox services. We really try to make sure that we're meeting them at the whatever level of service. So as you can tell, our services kind of range across the board.
And you have a definite wide coverage too. You're not only located at 3010 Grand Avenue in Waukegan, but you have community health services all over the county. I think you have behind you about 7.
Yeah, so we have 6 locations where anyone can go. So we have locations in Zion, we have 2 in Waukegan, we also have one in Highland Park, we have one in Round Lake as well. So we are kind of spread out.
Chicago,
and of course, how could I forget, of course, North Chicago. And then another school-based health center. And then our other location is in Libertyville. So we do range kind of where the services are needed. We try to go where the services are needed and have care there.
Okay. Well, you mentioned that you do lake water management. Well, what does that entail with the health department?
Yeah, so this is the exact time of year to talk about it, right? We don't think about lakes in the winter when they're frozen over. But we do lots of things. So we actually manage the outlook on those lakes. So we try to look at the health of the lake, right? Just like all of us have health, a lake has a health as well. So we check for things like the level of E. coli. And that's important from a public health standpoint, because if the levels of E. coli, which can cause sickness, get too high, then anyone swimming in the lake can actually get sick. We all have some little bit of E. coli in our system, but if the levels of the lake get too high, then we actually will close the lake and say that it's not safe to swim until that is addressed. So we kind of manage that. We take samples of the lakes on a regular basis and then process those samples. And again, if the levels are too high, then we would close the lake until the beach until those get resolved.
Okay, well, what are your more common services? I mean, the regular services that you give, what are the most common?
So definitely, I think for us, a lot of what we do is, community health centers. So we have, like I said, our community health center network. We provide full range of primary care services. So it could be that they're coming in for a school physical. Maybe it's a newborn and they're coming in for their well-born check. At our health centers, you'll have lots of crying babies. You'll hear that because we do lots of immunizations, right? So crying babies usually is not a good thing. For us, it means that they're getting immunized. So we're kind of happy when we hear that, as long as they don't cry too long.
Yeah.
But so it's that level of services. But we also do a lot of services with chronic diseases, right? So we have patients that may have diabetes. Not only do we provide primary care service for them in terms of a medical visit, we provide nutrition services. So we teach them how to eat, what's a healthy diet, what things are not good, and how do you exchange it for something else. Our nutrition staff also does cooking demonstrations, so they don't say just eat these foods. They actually teach people how to eat those, so we have those level of services. We have tobacco cessation services, so if someone smokes, we really want to make sure we're addressing that. Tobacco use is really the leading preventable cause of death. Over 600,000 people die every year from diseases related to tobacco.
Wow.
So we focus a lot on decreasing the rate of tobacco use for those that have already started and really preventing those from starting. So those are the types of services we do in public health.
Well, Anthony, are there any, Antonio, I'm sorry.
Sure.
I can call you Tony.
Tony, yes,
okay,
that would be
Tony.
great, thank you.
Are there any fees involved with any of the services that's provided by the health?
Yeah, so in our community health center, we are a federally qualified health center, so there is a cost. One of the things that the government, which helps to fund this, the federal government, is to make sure that we have a sliding fee scale. So if someone is below 200% of federal poverty level, they're going to be based on their income. So a family that has a certain number of individuals, we would take that into consideration, and we would slide the fee. What we primarily try to do is sign people up for insurance. So if they're eligible for either the marketplace enrollment or Medicaid, we would sign them up on site, be able to get them that, as well as some of the other benefits as they qualify. So we always try to make sure that cost is not a barrier for someone, and if they can't pay, then we work with them on that payment
That's
structure.
great. That's great.
As a public health organization, I'm sure you get a lot of messages out, and you want to tell us, how do you get the message out to the public concerning your services?
So we use a lot of different methods. Thank you. This helps. One is to have programs like this. We also use social media a lot. So we have lots of tweets that go out on a regular basis. Our Facebook page. If you haven't signed up, please sign up for our Facebook page at the Lake County Health Department, because we get messages out that way as well. We also do lots of press releases. So as we're having releases, we release them, and the media locally has been really good at making sure to get messages out to the public and work with us on those types of messages. So we'd use a broad range of services. Sometimes we actually just even have community events where we go out there. For example, we stressed a lot on, June was Men's Health Month. And so we spent a lot of time actually talking about men's health, but we had one of our nutrition staff go out to a community church and provide education directly there. So we try a broad range of ways to do that.
Wow.
I mentioned that because you have so much activity going on. You have a communications manager, right?
We do, yes. We have Leslie Piotrowski is our communications manager. She does an incredible job with her and her team at getting information out to the public, and we couldn't do it without her. She's great.
As a matter of fact, I think you have a monthly program too that you have, right?
So we do. One of the things we do is we have, and I'm glad you mentioned that, Dr. Brooks, we have a newsletter that goes out. So if anyone signs up for us, we can actually have the newsletter. They can sign up at our website at health.lakecountyil.gov. If they sign up for our newsletter, every month there's actually a video in there, and Leslie will talk about what's relevant for that month. So some people like to read and some people like to watch the videos, or do both, but we produce those every month.
Wow.
Yeah, I mentioned at the top of the program, you're interested in healthy people, healthy choices, and healthy Lake County. So you want to see a healthy Lake County, right?
We definitely do, yeah. We try to focus. Like, for example, as I mentioned, last month was Men's Health Month, and we really stress what are the messages that we want men to do. We're pretty good about going to the doctor if we're sick, right?
Okay.
And maybe not always even then, but if we have to go to the doctor, we'll go. But what we really stressed is Men's Health Month is about prevention. It's about going to your doctor not only when you're sick, but at other times. And what are the healthy lifestyles you can have? So for example, if you smoke, how do you stop smoking? That's critical that we make sure you do that. If you're not getting enough physical activity, increase your physical activity. The recommendation is that you do 150 minutes of strenuous exercise every week. Now you can't do that all in one day, but you could do it over the course of a week. So maybe you have 10 minutes. You do it 10 minutes in the morning, 10 minutes in the afternoon, and try to get it that way. So we want to make sure that we stress that. Other things we talk to men about during this time is making sure that they increase their fruits and vegetables. So if you eat a lot of fruits and vegetables, you're probably less likely to eat the things that are not as good for you. So those things that are high in sugar, high in sodium, high in fat, you'll eat less of those if you're filling up on, on fruits and vegetables. And then getting, enough sleep. We need 7 to 9 hours of sleep a day. We're probably all not as good at that as we should be. So it's a reminder to ourselves, and decrease your stress levels, as well. But the most important thing we really stress in that is go and get preventative services, right? So go to your doctor, even when you're not feeling well, that's the best time. I mean, when you are feeling well, that's the best time to go. Have your annual physical, make sure that they're doing your preventive medicine services, so that if something is detected, they can catch it early and treat it early before you have complications.
Okay. Well,
Now, some of the challenging, experiences that you have and you probably would not like to have is disease, is outbreaks. You have, in one time we had tuberculosis, diphtheria and so forth. So Ebola, I guess, you mentioned about the water. But you do preventive maintenance so that people won't, so that you do not have an outbreak, right?
Right, so we actually focus on both items. So as a public health department, we definitely stress prevention. So for some things, there are you can take vaccines. So we try to stress if you're able to have a vaccine to do that. For other chronic diseases or other diseases, you're not able to do that. So there's not a vaccine, for example, for TB. So what we do instead is we try to make sure that if there is a patient in the county that has TB, that we're actively monitoring them and that we're assisting that person to make sure that they go through all of the care that they need to get the treatment for the 9 months and that they're taking their medication. So we really assist them in making sure that's a successful treatment, which helps prevent them from spreading it to someone else. So that's something that we spend a lot of time within our communicable disease program. But some of them are things you might not think about. So if there's a restaurant that, for example, were to have a problem with food preparation, we would know about that. We would go out and help them to make sure that that would be okay. So we don't always, sometimes it's not when you inspect them that you find a problem, but it's later if somebody gets sick. So our goal is really about education and keeping people safe. But I'm glad you mentioned some of the other challenges. There's lots of, not necessarily new diseases, but they may be new to us or potentially challenging. So most recently, we've had the challenges with Ebola, and we've watched that fairly closely and participated and did a lot of training with not only our own staff in the health department, but collaborated with the hospitals, which were great providers. They were ready in case anyone had symptoms in the county to be able to have them go through there. They knew all the algorithms to make sure that someone had to actually travel from one of those infected countries. It wasn't just the symptoms. So we spend a lot of time working with our hospital partners and other healthcare partners as well. So whether it's something that we've been fighting for hundreds of years like TB or something that's a little newer like Ebola, we really take a comprehensive approach.
We're trying to keep the program current, and as of today, I just watched it on television. I do watch a lot of television. I just don't appear on television, But the state of California, I guess the governor issued an edict to require youngsters to have the vaccine, before they go to school. But is that a good idea, or would you recommend that you require? But now it's option, I guess, for them to take the vaccine before they go to school.
So the vaccine is required in Illinois as well. There are exemptions, though, and the exemptions in Illinois are self-reported. So a parent can decide that they may not want to for various reasons that they don't want to do that. One of the challenges we have is we want to make sure that the children are vaccinated, because the repercussions of those of not being vaccinated can be problematic. And we saw the challenges with measles fairly recently in California, where it spread extremely quickly when you have an outbreak. So if you have 1 or 2 children that are not immunized, that could potentially be an area that's at risk. So we really stress that parents have this conversation with their provider. If they're not comfortable with vaccines, that they have that conversation with the provider to explain why. There were lots of myths that happened from years ago in terms of a false study which indicated that there were lots of complications from vaccines. We now know that that is not true. But it's still out there. And so that's why we always stress, we definitely want to make sure that parents vaccinate their children. And if there's a legitimate reason that they don't, then have a conversation with their primary care provider to understand the risks and the benefits of doing that and make an informed decision.
Well, how many vaccinations are required? I mean, there's a certain set. I mean, my children long ago, they didn't get as many as what I hear some infants are receiving. So.
Yeah, so the number of vaccines hasn't increased that much recently. There are some newer vaccines that are out there that probably were not out there before. So more of a requirement around meningococcal. Some of the other, vaccines that are some of the newer.
I'm sorry.
So meningococcal is to prevent meningitis.
Oh, okay.
Yeah, and usually it was given just to college students, but now we're trying to move the age down, even further. So there are a couple of newer vaccines. Mm-hmm. I think though one of the keys is that the kids get their series, and it's usually when they're young is when they need the most vaccines.
Right.
So definitely keeping them on that series. If they fall behind, then have them catch back up. One of the nice things we do at the health department is if a parent is having a challenge getting vaccines or isn't sure if they're on schedule, they can actually come to our vaccination clinic that we have. So we have an immunization clinic that they can get the information on our website, and they would actually be able to come to that health center and learn which vaccines they're on, are they up to date, and if they're not up to date, they can actually help them get up to date. But I also wanted to remind us, vaccines are for adults as well, right? So we also need vaccines. We think of them for children, and we're comfortable getting some vaccines, like flu vaccines. We all know we should get flu vaccine every year, but there are other adult vaccines like pneumococcal or for tetanus and others. So we want to make sure as adults that we keep up to date as well. We don't luckily have to get them as often or as many as children get, but we should make sure that we're talking to our provider. And based on our own risk factors, we might have to get them more often.
I was going to say, good luck with getting some of the adults in.
Yes, then you might hear some more crying, right? In
Yes,
the adult
a lot
area.
of crying.
But we definitely want to make sure, you know, vaccines are one of the best ways to prevent communicable diseases. And for that individual, a vaccination such as, you know, a varicella vaccine that can help prevent some of the things is really important. So as adults, we should also be having the conversation with our primary care provider.
And we're also interested in the Lake County Health Department's involving responding to emergencies. What's your involvement there?
We do. So we participate in the response with the county as a whole. So we're pretty lucky that our county has a very comprehensive emergency response system. And what we do is we participate as needed. So if there was an event that required health to be part of it, we would just roll up into that overall structure. You can get information at Alert Lake County, and they would be able to online and be able to tell the information. But we would lead efforts if they were, for example, related to health issues. So a couple of years ago, where we had H1N1, we were the emergency department that actually led that effort to make sure we did mass vaccinations. If there were a bioterrorism or other event, we'd probably be the leader, working with other departments, but making sure that the health aspect of it, so whether it was medication adherence, we would do that. And we've been pretty lucky to partner with lots of our community partners. So the good thing is you don't have to figure, in those events, if you needed a vaccine, you wouldn't have to figure out where to go. We set them up at polling booths, right? Because everyone knows where they vote. So if you know where you vote, you know where you actually would have to go to get that kind of medication or vaccine.
Wow. Okay.
You mentioned about you're involved in environmental health programs too, right? That's naturally.
Yeah. So there's quite a few environmental health programs that we have. Some of them are the lakes management program that we talked about earlier. So we manage kind of the lakes and have control over making sure that they stay healthy. In some of the environmental programs, we also do pool inspection. So we inspect pools that are community-based pools and make sure that they have the right levels, or wherever people are getting tattoos, we also make sure that we're regulating those as well. So there's lots of that. We work with landfill providers as well and kind of assist with them. They're pretty good at making sure that everything's under control. And then through the state, we have delegated responsibility to help work with them. So there's quite a few programs within environmental programs.
Wow.
Mr. Beltran, do you find, or have you found there's health disparities among minorities? Because here you have Lake County is a perfect example of just about all minorities, you know, although it's one of the wealthiest counties in the state and probably the country, you know, but there's still
a lot of crazy, I mean, can't say that word, huh?
Disparities among minorities. Have you, health disparities?
Health disparities.
Yeah, we definitely have health disparities, and I think that's part of the challenge, you know, dealing with any public health environment. So we see some of the disparities in things like hypertension that may adversely affect the African American or the Latino population, and the same with diabetes, which kind of has higher rates in those areas. So we do a lot of work. We've focused in our strategic plan. We've spent time saying we want to address those areas and put clear guidelines. We're starting here and we want to move the disparity to this point. In those areas that we have the disparity are also in the areas where we have our health centers. So our public health work in terms of looking at the overall health of the county as well as our direct service clinical services kind of collaborate hand in hand to help improve those disparities of the residents that are living in those areas.
You have certain diseases like sickle cell anemia it occurs more in African Americans than it does in other of the groups, right?
Right. So sickle cell, unfortunately, asthma is also one of the other areas that
Yes, there's a
is
lot of
higher in
asthma.
African American, community. We spend a lot of time working with our partner hospitals on low birth weight because that disproportionately affects the African American community as well. The Latino community actually does a little bit better and doesn't have the health disparity there. So we really, instead of taking broad strokes, we get down to the nuts and bolts of how do we have to impact those areas and how do we help those specific groups. But yeah, we definitely look at health disparities and have included it as one of the pillars within our, one of the 4 pillars within our strategic plan.
Okay, another one, we hadn't talked about it before, but affordable health care. How is that affecting the health department's policies and so forth?
Yeah, so, I want to take this chance to really brag about Lake County as a whole, because this is, I think, where we were just ahead of where others did in terms of implementing this. So we knew we had a large number of people that did not have health insurance.
Okay.
And the challenge was that wasn't just those that were on the lowest end, but also there were many people that had higher means that didn't have health insurance, whether it was because of pre-existing conditions or not getting affordable health insurance. So we actually had people in all different categories that didn't have it. And what we did as a health department, we worked with a lot of different partners, and we applied for a grant called Enroll. We called our program Enroll Lake County, and there were lots of community partners that were in there, as well as all of the hospitals in the system, in the county, participated with us. And what we did is we enrolled over 80 navigators. And so in order to sign someone up for health insurance, you had to be a certified navigator. That meant you have to go through the state's training, you had to go through the federal training, and you had to go through classroom training and pass exams related to that. You couldn't just decide, today I want to be a navigator, I'm going to go give advice. You had to pass all of those. So we had lots of partners. Some of them, through the grant, we were able to pay those agencies. In other cases, we had lots of volunteers that went through all of that training and were participating through that. So in the last 2 years, we've been able to cut the number of people that do not have insurance. Through the Affordable Care Act, as of May of this year, 42,000 people in Lake County have signed up through that program, and about 20,000 people have gotten access to Medicaid through that program as well. So it's been good to be able to make sure that we're providing care. One of the biggest barriers to accessing health care is not having insurance. And so this was a great win for the county, but I really have to thank all of our community partners who did such a heavy lift in getting this program up and running.
Well, I would like to compliment you on that program because the marketing that they did to get people enrolled, I mean, you saw them at the colleges, you saw them at events, you saw them all over the place signing people up, answering their questions, and getting involved with clients to get signed up. And I thought it was wonderful that Lake County Health Department took that initiative to enroll people, in, because healthcare is a large issue.
Yeah, we were excited that so many people came to the table. So many partners wanted to participate, whether it was townships or libraries, like our local Waukegan library. All of them came to the table and said, we're going to participate in this effort. We really want to make sure. And the amount of time it takes to sign someone up takes a significant amount of time. But I'm sure you can attest, they were always willing to answer the million and one questions that people had, because it was fairly complicated. So thank you for that compliment, but really our partnerships were great in this effort.
Okay. That's great.
This is fantastic. Well, to carry on all of your programs, what about the budget process? Tell about the funding.
So we have funding from lots of different, different sources. So we do receive a significant amount of funding from the county. Our budget overall for the department is over $70 million to run all of those, those programs. We have a portion of it that comes from, from the county, and they've, been extremely generous. Our county board members really support the health and welfare of the county and want to make sure that happens. But we spend a lot of time getting grants. We have tens of millions of dollars in grants that we're able to bring in each year, and many of those are federal grants that kind of come to us, so we bring that. And then we bill for the services that we have. So for many of our patients that come through either our behavioral health services or through our Medicaid services or our vaccine or TB, any of those services, if they have Medicaid, we make sure that we bill their insurance. So we get tens of millions of dollars through billing insurance plans as well. And that makes up a full complement of the types of revenue sources that we have.
When you get the tens of millions of dollars grants, is that based upon what criteria?
So usually it's a lot of different grants. So I wish we could get these big, large ones, and they would be really. Okay. It's usually smaller grants. So there may be 100,000, they may be 200,000. One of the largest ones we had recently was the Enroll Lake County community-based grant, which was about $1 million each year. Okay. But some of the grants could be as small as $100,000 that we get. We do get a lot of grants from the state, so we're able to provide services, particularly in behavioral health. We have quite a few grant-related programs, but they're very specific to that level of service. And we only go after grants that we think make sense to help improve the health of our residents.
This is fantastic. It seems like the Lake County Health Department is taking the lead in a really concerning concern about the citizens. And I keep mentioning about your theme. You got a great motto there: healthy people, healthy choices, healthy Lake County. And that's so much to get the Nobel Peace Prize for coming up with that motto, because we look at several states that just turn back money, refuse money to take care of its citizens. And I think if our citizens would take a look at that, they could see how fortunate we are to have the Lake County Health Department like we have.
Yeah, thank you.
Well, Dr. Brooks, he's an example of good leadership. When you have a good leader, you have the programs that can move forward. You have the people that that can get the job done. You have the connections with the community. And that's what it seems like what he's projecting is that he's involved with every aspect of the health department.
Yeah, and I think I'm really lucky. I've been at the health department a little over 2 years, but the health department's been around since 1956. We've been around for many years, and I've been lucky. The executive directors prior to me have built incredible networks in terms of the types of work we do. But more importantly, when I get a chance to go talk to the staff that we have and the work they're doing, it's incredible. So recently I was able to visit one of our programs that does family case management. So it was nurse-family partnership. And as I listened to the nurses talking about the amount of education that they provide to each of the clients, the type of work and how they're really impacting, it really gives me a lot of joy to see how those one-on-one relationships happen. But it's every single program that I get a chance to go to. If you could see the passion that our staff have in terms of the work that they do, whether it's direct services in nursing, whether it's making sure that we're covering abandoned wells, or giving vaccines, all of those improve the health and wellness of our citizens. And everyone considers that. We have this one program called our Women's Residential Program, and in that program, we provide services to those that have addiction, so women that are coming in for addiction. And they stay there for a while, and they're getting care and having that service. And when the facilities group was looking at rehabbing that, they really changed the way, for example, the bathrooms were set up. And it's a small thing, but when I asked, well, why did you change the bathrooms and the sinks? And they said, when women stay here, we want to make sure that they feel comfortable, that there's place to put all of their private stuff, that they have a way to think. And to have our staff think about how the direct work they do impacts our clients and making sure they want to care. I couldn't get them I couldn't buy that kind of expertise, but all of them do it. And so that work goes hand in hand with the incredible work that the therapists are doing at that center. So I'm really lucky, it's great to be at the helm of the health department, but it's really our staff that are doing the day-to-day work, and I'm always impressed with them as I meet them.
Well, that's great. Very helpful. Yeah. 2 years. It seems like you've been there a long time.
You have control of the nursing home too.
So Winchester House. Yeah, Winchester House is not part of the health department. It's separate from the health department.
Okay. Now, You have an opportunity to go to the county board at least annually to present your budget, or so that they will know what good things that are going on within the health department. You
Yeah,
have that
so
opportunity?
we're really lucky. We have a unique structure at the health department. So every we have two governing boards so we have a board of health.
Okay.
That's appointed by the Lake County Board, and we
Okay.
meet with them on a monthly basis. But they really are the ones that have the
Okay.
governance over the day-to-day work that we're doing with the department. And then we have what's called a governing council. That's our federally qualified health center board, and that board really focuses on the medical services that we provide. The great thing about the FQHC board is it's made up of majority consumer members. That's a requirement from our federal grant,
Okay.
is that it's mostly consumer members, and they provide a wealth of experience to them. And then we have our county board that we do tons of work with, and it really has kind of the larger strategic vision of how the health department collaborates together. I've been really lucky. They've invited me to present at there are multiple committees that they have, and so I spend a lot of time with county board members. They're really passionate about lots of the activities that we're doing, whether it's work that we're doing with those with mental illness or jail diversion programs or some of the other programs. They're really engaged in that level. So, you know, I'm lucky. I get to work with 3 really strong boards, and so I don't only go to the county board when I need money, but on a regular basis they invite me, and it's amazing how quickly all the boards are able to pick up this information and kind of give us good guidance.
What I can understand that the county board is they got a huge county to cover, and they have committees. I guess you mentioned Board of Health and other committees that they work through to find out good things that you're doing.
Yeah.
In addition to that, though, I'm sure you have speaking engagements. Like, we're very fortunate. You have a very busy schedule, but you found time to come in to talk to, let's see, the Comcast population is approximately 100,000 people, but Lake County itself is probably 750,000. And so you're potentially talking to the people that don't get a chance to come in and talk with you, you know.
Yeah.
And it's appreciated very much.
No, I appreciate it. Thank you for inviting us. I think it's nice to be able to talk about the work that we do and how it can impact, and how others, they might learn something and want to, get services for us, or even just be aware of what we were doing.
Right. Tell us about your, you have a TB Center building now in Belvedere. Is that that's a huge facility there? I had a chance to visit there a couple of times, but it's operational, and it's a lot of activity there.
Yeah, so that's actually our largest community health center. So on that campus, there's actually several things at that location at Belvedere. In the main building, we provide primary care services. So whether it's pediatrics, adult medicine, family medicine, we provide that service, as well as dental services. Majority of our health centers have dental services directly in them. And then we provide other things like our Women, Infant, and Children Nutrition Program is also in that location. We do communicable disease in terms of STI care in that large facility. So if someone has a concern about a sexually transmitted infection, they're able to come there and get testing and treatment, as well as care for individuals with HIV. So it is a comprehensive location. In addition, we have a clinic that's right next door to it, but on that same campus, where we see individuals that can come in for TB tests. So we do thousands of TB tests every year to make sure. And then for those where the test comes back positive and they need treatment, we would provide treatment for them as well. When I mentioned our vaccine program for children, it's also on that campus. So families can go in, and it's in a separate building. So there's quite a few things there, as well as a group home that we have at that location.
You know, Tony, I mentioned about you're getting speaking engagements going out, but the public can make inquire about coming in to looking at the community health center themselves, right? For example, I know in Zion you got a huge one in North Chicago, and you mentioned other areas, about 5 or 6 different areas. But it's in their area, and it seemed like to me they would be interested. Organizations, for example, want to come in and take a look and see what is provided, right?
Yeah, so if they wanted to understand the types of services, definitely they can contact, contact the health department. We try to figure out what the need is, right? So just because they're in North Chicago near our health center, it may be another need that they have.
Yeah.
So we want to make sure that we're really providing what it is that they want. So it could be a different program. But definitely they should feel free calling us. When they call our main number, which is 847-377-8000, they'll actually get them to the right location. So they can they'll talk to them about what type of program they need, and then they'll be able to get information. If there are other community partners that want to work with us, definitely do the same thing. Give us a call, and we'll try to work with them as well. We definitely believe that part of public health is making sure that we're community-based, and we can't do all the work ourselves. Yeah. So again, it's one of the luxuries we have in Lake County is we have so many community partners.
You mentioned that you have been with the Lake County Health Department for 2 years, but have you had time to put a long-range plan in to see where would you like to see the health department in 5 years or maybe 10 years from now?
Sure. So we completed a strategic plan for the health department in 2013, about 6 months after I came. Okay. And we used our community-based strategic plan as the starting point to say what are the types of things that we want to actually do. So the goal was to make sure that our internal strategic plan matched with the community plan that they have. That plan will be ending in 2016, and we're actually working with the community right now on the next strategic plan. So we recently had quite about 100 different participants come in from the community to start talking about the next plan. But in our current plan, there's quite a bit that we want. Health disparities was definitely in there. But there were 3 things that I could give you some feedback that we've really said, this is a plan and how we want to improve them. So the first one was to decrease the number of deaths due to opioids. And so we know there's been a challenge nationally in terms of the number of individuals that are using either heroin or prescription-based opiates. And so we wanted to make sure that we could help decrease the deaths related to that. In 2012, there were, I think, 46, and in 2013, there were 49 deaths related to opiate overdoses. And so our goal was to try to decrease that. And so what we did is there was already a great group working on it, the Lake County Opiate Prevention Task Force, and they had lots of work that they were doing, but they really wanted to implement a drug called naloxone. And what that drug does is it stops the effect of an overdose. And so as a health department, we supported that community event, that community initiative that was out there, and we were able to train the law enforcement officers. We trained a cohort, and then they went out and trained others. But we also said we need to get them the medication. So our manager of that program, Susan McKnight, actually worked with a company and was able to get a donation for the medications to give us a start. That donation was worth about $1.4 million. Wow. But it was really to start us to get that awareness and have that services. The other program we really wanted to focus is decrease the barrier to care. So Enrolla County was one of those things. We had a goal that we wanted to make sure over 25,000 people would get access to health insurance, and we're lucky that that has now happened and that was part of it. But another thing we wanted to do to decrease the barrier was really to make sure we could provide services where people needed it. And so opening our school-based health center at Round Lake High School was one of the other things that we were able to do. So that opened last school year. So they've completed now 1 school year. It was a long community process. So they spent over 5 years planning how they were going to do that. They actually built an addition. We were able to get a federal grant through the health center to build onto the school, but really all those school partners were the ones really driving what types of services they wanted. So reducing care was another one. So that was something that came out of our strategic plan as well.
Another asset too would be training for employees. There has to be continual training, right? If you want to keep the high level of services that you provide. Is there a formal training program there for your employees?
So we do. We have health education staff that do that. So whether it's something as standard as CPR training that staff, there's a whole cohort of staff that have to do it every year, so we provide that training. But we have very specific training. So whether it's how to use our technology system, whether it's to make sure that they're up to date on vaccines or how to give them, we have a regular training schedule for all of our staff.
Well, now I wonder, with all the things that Tony's involved in, is there any time for leisure time activities?
Well, that's up to Tony.
Yeah.
Isn't it?
I do. You know, one of the things I probably have to be better at is sleeping. That's probably the best leisure time.
Doesn't sound like you
you know,
sleep at
activity.
all.
But for me, one of the leisure activities I do is actually working out. So I work out every morning. It's actually a stress relief for me.
Okay.
So some people work out for various reasons. I work out because it relieves my stress.
Yeah,
It helps
yeah.
clear my mind. I get to, you know, start the day off on a fresh note. So some may not consider it leisure, but for me, it's one of the things that really helps me get through the day.
Yeah.
That's the way to get through, huh?
Right, right. And, so no golfing, you have time for golfing?
I don't golf. I know I need someone to teach me how to golf, and then maybe I would golf and get up my skills there. But no, I don't golf. I like to do other things. So I go to restaurants as much as I can. That's probably the other thing I do, is try to eat out as often as I can.
Right.
Although I like to cook, I actually like to eat out even more, because then someone else gets to clean up. So that's always nice.
Now, you talk about the men's health. Now, do you eat vegetables and fruits and, you know, regulate your diet for yourself?
I do, and you know, that's what I found. If you really try to get as much fruits and vegetables as your recommendation, you'll actually decrease all the other things that you shouldn't have because you don't have room for them. And so it's really nice to make sure that I get those in.
Okay, well, that's good. At least the men know that you're doing it. You're setting the example. They have to eat. And you look good. You look great for, you know, for leading that type of services in the department itself.
Yeah.
Right, Dr. Brooks?
Although I will say one of the things, and my staff know this as well, I try not to have cookies around, because if cookies are there, then I'm going to eat them.
Even though it's sugar-free?
Even if it's sugar-free, I'll probably will be better, but that's the one indulgence.
I'm hooked on sugar-free cookies.
Okay, yeah, that's the one indulgence I have, is cookies, so I try not to have those around, or just don't let me know that they're there so I won't eat them.
Yeah.
Okay. Could you tell us about where, which was the main Lake County Health Department? Like you had mentioned, the number to call when people want information. It's like one number, and they can go to each department.
Yeah, so if they call, the main number for the health department is 847-377-8000, and they'll actually make sure that they get to the right location. If they wanted to find specific information about the department, our website is actually really good. So there's lots of information. So that's health.lakecountyil.gov, and they can look at all the different programs that we have. But again, if they're not sure which one to call or what to do, just call the main number at 377-8000. They'll get you to the right location.
Okay, great.
Well, when you come to work each morning, there's probably no one set thing you have to do. No set problem. You never know what's going to confront you, right? When you
Yeah, you know, every day is a little different, so I guess I have that luxury, right? I get the advantage of doing lots of different things and meeting lots of different people. I think that's been one of the most enjoyable things in the last couple of years. It's just the amount of people that I've been able to, you know, meet, whether it's going to meetings and thinking about ways we can collaborate together, or one of the things I enjoy the most is really getting out and having a chance to learn about the day-to-day stuff that our staff does as well. So that's the one constant, is I always get to go and talk to people, and I think I like that the most.
some of the challenging experiences that you've had since you've been with the Lake County Health Department.
You know, I think, you know, it's been a challenge with some of the funding challenges. So although there's advantages, you know, to the size of our organization, I think all of us are experiencing funding challenges just with the current, you know, the current budget. What we think is we try to take every challenge and how do we turn it into an opportunity. Yeah. Mm-hmm. So for example, even going back to, you know, to our strategic plan, we knew that we have patients with severe mental illness, and unfortunately they died 20 to 25 years earlier than the general population. Okay. And that happens because of some of the chronic medical diseases. So whether it's diabetes, hypertension, obesity, or smoking. And we saw that as a major problem that we really wanted to address. And so that's when we opened our health center focused specifically on those with severe mental illness. We added primary care, and we saw it as an opportunity to say we can improve the health and wellness of those individuals and make sure that we're providing care. So definitely trying to address that issue has been one of the, you know, one of the biggest challenges. And I think we have some good headway going in that direction.
I mentioned training maybe a couple of times, but I wonder, is there collaboration that the health department has with the College of Lake County?
So we have had some collaboration with them, whether it's to have students or interns work with us. We definitely try to collaborate with them. They've also, when I mentioned our community-based strategic planning process for the next strategic plan, College of Lake County was right there with us thinking about some of that planning. So we're really lucky to have such a strong institution in Lake County.
Yeah, I mentioned that because they have health services there too, health training services that, and also they have a multi-million-dollar project that they will be overlooking too in the next few years.
Yeah.
Too, you know. Okay, well, I really appreciate your time to coming out to share with us.
Yes.
And I hope we haven't missed any areas of the Lake County Health Department operation that you feel that our Lake County citizens should be aware of.
No, I think you guys did a great job of really covering a lot of it. It's amazing how much you know about the health department, so thank you so much.
And you've been a very interesting and informative guest at your explanation of what the services are, what you do, and how it's accessible to the Lake County residents. You know, most services are not very accessible, and that's why people get discouraged and they don't find a way to get there, anything. But you've explained everything. It's like, what's the reason why you can't get to services? You know, what's holding it back? You know, what could hold a person back? So I think it's great. I think it's great that we had that opportunity.
We have a couple of minutes left.
We do.
And I don't want to leave without asking my favorite question.
Okay, great.
Cultural diversity throughout the workforce in all of the positions that you have there, because I know you probably could take all day to talk about it, you know, but I just like to know that the opportunities that people have, since we have a culturally diverse county, you know, that they could look forward to in applying for jobs in the Lake County Health Department.
Yeah, so, you know, one of the things that we have is a diversity and inclusion task force. So that group really focuses on looking at that. And they start with the aspect of what are the needs of the residents that are there, right? So for some services, individuals may need to be bilingual. And so then they really work on what are the services related. But, you know, for us, we start with making sure that we're providing culturally and linguistically adequate services for whoever is coming. And so we look at that. But not all positions require, for example, certain language skills. Some require other skills in terms of sensitivity towards individuals with severe mental illness. And how do you work with those individuals or individuals that are dealing with substance abuse issue? And how are you culturally sensitive to really what they're going through and making sure that you're providing the right environment? So it is varied by, you know, by program that we make sure. But, you know, what I would say is if anyone's interested in the health department, because of the broad range of programs we have, go to the county's website where we have all the jobs posted for the county. And there may be one that they find that's interesting, you know, for them. And I encourage them to apply.
Yeah.
I know you may have goals that you may want to set up, but you will not set a goal that you need to be bilingual even though we have a bilingual county to achieve employment.
Some of our positions are required to be bilingual because they're there, but we don't have any service that's only bilingual. So we really, you know, don't want to limit others to say you can't apply for this service, because there are individuals. But we do have many positions in our direct services, for example, that they're required to be bilingual, because that's what we require.
You have your own human resource department. I know the county has a resource department, but they don't recruit for you then. You have your own human resource office?
So we collaborate really closely with the county's resource department, human resources. And but yes, we have our own human resource department and our own recruiter that really tries to understand the needs of that particular position.
Ladies and gentlemen, been dialoguing with the Executive Director of the Lake County Health Department, Antonio Tony, as he like to be called, Beltran. He's the Executive Director of the Lake County Health Department / Community Health Center, located at 3010 Grand Avenue, Waukegan, Illinois. And the motto is healthy people, healthy choices, healthy Lake County. If you want to make a call to make an appointment to see the services, you may call 847-377-8000.
Yes.
847-377-8000. And I want to thank our co-host, Nina Stokes, providing an excellent opportunity for us. Ladies and gentlemen, this has been Community Forum. My name is Dr. Waddell Brooks Sr., your host.